Ranexa is a medication used to treat a specific type of chest pain called chronic angina. It helps reduce the frequency of chest pain and may improve your ability to exercise. Ranexa works differently than other angina medications, so it can be used in combination with other medications such as nitrates, calcium channel blockers, and beta blockers. It is believed to work by improving the heart's ability to use oxygen, allowing it to do more work with less oxygen. Before starting Ranexa, it's important to read the patient information leaflet from your pharmacist. Take this medication by mouth as directed by your doctor, usually twice daily. Swallow the medication whole, and do not crush, chew, or split the tablets. Avoid grapefruit or grapefruit juice while using this medication, as it can increase the chance of side effects. The dosage is based on your medical condition and other medications you may be taking, so be sure to tell your doctor and pharmacist about all the products you use. Use this medication regularly to get the most benefit from it, and consult your doctor if your condition does not improve. You may experience dizziness, headache, lightheadedness, nausea, tiredness, and constipation while taking Ranexa. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, tell your doctor right away if you have any serious side effects, including signs of kidney problems or very serious side effects such as fainting, severe dizziness, or fast/irregular heartbeat. A very serious allergic reaction to this drug is rare, but seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so make sure to contact your doctor or pharmacist if you notice any other effects. Before taking ranolazine, make sure to tell your doctor or pharmacist if you are allergic to it or have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. It's important to talk to your pharmacist for more details. Before using this medication, be sure to tell your doctor or pharmacist about your medical history, especially if you have liver problems, kidney problems, or certain heart conditions. Ranolazine may cause a heart rhythm condition called QT prolongation, which can rarely cause serious symptoms that need immediate medical attention. The risk of QT prolongation may increase if you have certain medical conditions or are taking other drugs that may cause QT prolongation. It's important to tell your doctor or pharmacist about all the drugs you take and any of the following conditions you may have. Low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation. This risk may increase if you use certain drugs or have conditions that lead to low potassium or magnesium levels. Talk to your doctor about using ranolazine safely. This drug may make you dizzy, and alcohol or marijuana can make you even more dizzy. It's important to avoid driving or using machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Before having surgery, make sure to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially QT prolongation. During pregnancy, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. Now let's talk about drug interactions. It's important to know that other medications can affect how Ranexa works in your body. This means it's important to keep a list of all the products you use and share it with your doctor and pharmacist. They need to know about all the medications you're taking, including prescription and non-prescription drugs, and herbal products. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some examples of medications that can affect the removal of Ranexa from your body include azole antifungals, clarithromycin, HIV protease inhibitors, and drugs used to treat seizures. Be sure to talk to your doctor about any medications you are taking if you are prescribed Ranexa. If someone takes too much Ranexa and shows signs like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for your local poison control center. If you're in Canada, call your provincial poison control center. Symptoms of an overdose can include severe dizziness, fast or irregular heartbeat, changes in mental state, vomiting, severe tremors, and unsteadiness. It's important to remember not to share your medication with anyone else. Your doctor may also want to monitor your kidney function through lab tests while you're taking Ranexa, so be sure to keep all of your medical and lab appointments. If you have any questions, consult your doctor for more details. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed one. It's important to store Ranexa at room temperature away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.